guys, Katie Kleber, Tosh Kleber here. We just wanted to discuss having a care plan with you. So creating nursing care plans is kind of a headache, and I just want to go through a process with you of potentially making it less of a headache. So scenario we're going to paint is that you're a nursing student, you got your patient assignment, and you have to create a care plan based on this next clinical. Okay, so that was typically the timeline, was like, hey, you know, Mr. Smith is going to be your patient. You go in the night before, you get information, you take care of him, care plan due at the end of the week. So that's kind of what I want you to kind of have in your mind while I'm going through this and this plan. Okay. Step one will be to collect your information. So that will be, you know, if you go in the night before and you look at the chart, you could gather information. Okay. So, but the information doesn't just come from take one look at the chart. So take a look at the chart, get some notes written down, just information about the patient. Don't think nursing diagnosis specifics yet. You're just gathering information at this point. So gather information, you know, the night before you meet the patient, and then do your clinical, you know, write down report, have conversations with the patient, do a full assessment, look, you know, and talk with the other healthcare professionals, the physical therapist, occupational therapist, the physician, you know, the chaplain, the nutritionist, everybody. Do your clinical, go through it, and then before you leave though for your clinical, look at the chart again. Sit down, kind of take a break from the rush of clinical, and just look at the chart again, and and go through and see if there's anything else that kind of stands out to you now that you know the patient, you've seen them. Have one more kind of sit down session looking at the chart like you did the night before. Okay, so you've got all of your information, okay, and you take a look at all of that. Lovely, lovely, lovely. Okay. Now, don't just after clinical go home and just try to write a care plan real quick. If you can, wait till the next day. Just kind of stop and reflect and just kind of think about big picture, what was kind of going on with the patient, what was important for the patient to get through that day, etc. And then sit down the next night, hopefully, if you can. Sit down and really think and get a piece of paper out. Don't get out your textbooks yet, just get out a piece of paper or a Word document and just take notes and think about really layman's terms. Don't worry about the nice, you know, medical jargon and stuff, but write down some of the big problems that you noticed. So like, okay, he couldn't poop. Nope, no poops. Was unsteady getting up. Didn't have much of an appetite. Struggled with pain. You know, those kind of things. Write it in really layman's terms, okay? And then take another break, okay? And then go back through, after you've taken your break, you've had a time to, you know, kind of chill out a little bit, go back with fresh eyes with your care plan textbooks, whatever those are that you're using at school. Maybe you have a NANDA, Nick and Knock, separate ones. Maybe you have one big one. But then take a look and look at those few like things you identified. And however many diagnoses you have to come up with, try to, you know, stick to that. But look at those sentences that are really informal that you wrote down and see how you can translate those into nursing diagnoses. So can't poop becomes constipation. Weak when they're getting up, that could just be weakness, or you could have impaired mobility or that kind of stuff. So write down those, the diagnoses, and then work through each of them with their related to factors if they're necessary, and their defining characteristics if they're necessary, and think back, okay, I knew he couldn't poop, right? So what made me think he couldn't poop? Did he tell me? Most likely he did. If he didn't, did I hear hypoactive bowel sounds? You know, did I notice he was not on a bowel regimen? You know, those kind of things. And think about, okay, what could this be related to? What's his underlying diagnosis? What other things are going on that could be related to this? And then go back and really go back and translate that whole diagnosis and create that. And that's real. I think that's one of the biggest parts, is getting that in. And then take a look at your subjective, objective data, your related to factors and stuff, and how, and we have a great post. We'll put the link to it at the bottom of this video for knowing the difference between subjective and objective data. I know that can be a struggling point. So make sure you look at that. And then go through your interventions that you did or would do, and then why you would do them, and did you do them, your implementation, and then evaluation. So thinking about practically, my patient can't poop, what kind of things should I do to help him work on constipation? Maybe we'll make sure he's got adequate fluid intake. Maybe we'll walk around and stuff, get him moving, increase fiber intake, make sure he's on a bowel regimen, appropriate medications are ordered and that kind of stuff, and any unnecessary medications that cause constipation are stopped, or if he doesn't need maybe opioid pain medications, maybe we can try and get off of those, and that will help with the constipation, and the reasoning for those is pretty clear. Did you do it or not? And then, was it successful? So I think that's a kind of a plan. If you kind of have looking at going in to do the care plans as like this big thing, you're picking up pieces along the way, and then you can sit down and then piece it all together, as opposed to get your clinical information, go through clinical, then sit down and try to put it together. It's kind of a little challenging that way. So if you can really go at it with a plan and okay, I'm going to look at the chart once before, get the information I need. Okay, now I'm going to assess my patient, listen to a report, talk to other members of the healthcare team, and look at the chart again with new eyes. And then I'm going to sit down and I'm really going to think big picture, layman's terms. What are some big things I want this patient to progress in? Okay, now let me translate that into the NANDA specified terminology, and then let me go back and really think, how did I know that was a problem? And what could that problem be related to? And then how am I going to address that problem? Interventions. And then really go into the book and look at the interventions and the outcomes, because that's a little bit easier to get to when you have that diagnosis very clearly defined. So that's my tip for having a care plan. We have a template that might be helpful for you. NRSNG.com/care plan template. We'll put the link to it at this video. Great little cheat sheet kind of thing that it's a great download. You don't have to worry about trying to format one on your computer, which can be kind of a headache. It's just real quick, and then you can save it and use it over and over and over again. So I hope that's helpful, and I hope that makes creating a care plan a lot more of a doable task. And remember that it's challenging. You haven't seen a ton of patients yet, so some of this stuff that comes really easy to experienced nurses is because they've seen a bunch of patients and you haven't, and that's okay. So this stuff should be challenging. So you need to utilize your professor's office hours. There's no shame in that. Get the learning that you need, the learning that you're paying for, and really take some time to really dive into it. So Tosh and I thank you for watching, and we hope that this helps your next clinical and care plan experience go by a little smoother.